How does disrupted homeostasis cause disease in medical pathology? Imagine your body as a finely tuned machine that keeps everything running smoothly. When parts of this system fail or go out of sync, problems start to appear. That's what we call disrupted homeostasis. It's like a thermostat that stops working, and suddenly your house gets too hot or too cold. In your body, this imbalance can lead to illness. Homeostasis is the process that keeps your internal environment stable. Your body controls things like temperature, blood sugar, blood pressure, pH levels, and electrolyte balance. It uses feedback loops, which are like signals that tell your body to turn things up or down. Sensors detect changes, control centers decide what to do, and effectors carry out the actions. Most of these loops work through negative feedback, which corrects deviations from normal. For example, if your blood sugar rises after eating, your body releases insulin to bring it back down. When homeostasis is disrupted, the body's internal environment shifts away from its normal range. This can happen if sensors are damaged, control centers malfunction, or effectors don't respond properly. Take diabetes, for example. The pancreas either doesn't produce enough insulin or the body's cells resist insulin. This causes high blood sugar levels that can damage nerves, eyes, and kidneys over time. Another example is high blood pressure, or hypertension. If the mechanisms that regulate blood pressure are impaired, it stays elevated. This puts strain on blood vessels and organs, increasing the risk of heart attack or stroke. Lung infections like pneumonia or acute respiratory distress syndrome cause inflammation and fluid buildup in the lungs. This disrupts normal oxygen exchange and can lead to tissue injury. These cases show how failure in homeostatic regulation is at the core of many diseases. Sometimes, when the body tries to fix an imbalance, positive feedback loops take over. These loops make the problem worse instead of fixing it. For example, in severe lung infections, inflammation causes fluid to leak into the lungs. This fluid feeds bacteria and worsens inflammation, creating a cycle that's hard to stop without medical help. As people age, their homeostatic systems become less efficient. Older adults may struggle to regulate body temperature or blood sugar. This makes them more vulnerable to heat stroke, infections, or metabolic issues. It's a reminder that maintaining balance is a dynamic process that can weaken over time. In medical school, recognizing signs of homeostatic imbalance is key. Checking vital signs like temperature, heart rate, and blood pressure gives clues about what's going wrong. Lab tests such as basic metabolic panels help identify electrolyte or glucose problems. Understanding how these imbalances happen allows doctors to target treatments effectively. For example, giving insulin for diabetes or antihypertensives for high blood pressure. Practicing how to interpret clinical data helps future doctors spot these issues early. If a patient shows confusion and high blood sugar, they might have diabetic ketoacidosis, a serious disruption of glucose balance. Correcting these problems quickly can prevent serious complications. In the end, disrupted homeostasis is a fundamental idea in pathology. Many diseases happen because the body's systems fail to keep everything in balance. Recognizing these failures helps in diagnosing and treating illnesses. Mastering this concept is essential for anyone studying medicine because it's the foundation of understanding how health and disease are connected.